Hi, I'm Dr. Jason Wagner, Sarasota Vascular Specialist, and thanks for joining me for another Whiteboard Wednesday. Today we're going to talk about vein ablations. A lot of my patients will say, hey, okay, I understand I need to have a vein ablation done, but what's a vein ablation? So a vein ablation is when we're shutting down a bad acting vein. The first and most important thing we need to do is make sure that all of the other veins are doing their job and they're good veins, specifically making sure that the deep veins are open. That's one thing that will separate a board-certified vascular surgeon and a certified vein center like ours. We pay attention to the deep veins. So before we even get talked to about having a procedure done, we want to make sure that the deep veins are open, that they're doing their job, and that whatever vein we're talking to you about shutting down, usually it's a superficial vein, is the bad acting vein, and that all the other veins are there to keep doing the normal good work, and that we just get rid of the one bad actor. The idea of shutting down a bad acting vein is that this vein has bad valves that are letting blood settle the wrong way with gravity. The idea being getting rid of the bad acting vein, leaving all the normal veins to do their job. The leg swelling that's being caused by the bad vein goes away once it's gone. Years ago, what we used to commonly do was called the vein stripping, where we make an incision down here, an incision up here in the leg. This is the foot. I'm not an artist, I'm a surgeon. And we actually get a wire through it, and we actually kind of rip the vein out. It's like really strip the vein out. You're kind of starting a lawnmower. Pretty barbaric. We rarely do it nowadays. Now what we end up doing is we do what's called a minimally invasive or percutaneous, where we use a needle to get into the vein itself, ablation. The two different ways we can do it is either with a heat-based catheter, so a radiofrequency catheter or a laser catheter, or with a foam ablation, where we actually inject a solution that causes the vein to shut down, to kind of spasm down and stick to itself and shut down. I'm drawing a drawing here, and I've got the great saphenous vein as an example. That's probably one of the most common veins we treat. What we do is we access the vein, usually above the knee, and we get into the vein, with under ultrasound guidance. So this here is kind of a rudimentary drawing of what in cross section the vein looks like to us. So I've got my ultrasound probe up top, I'm looking in, and I see the vein here. This dot is an example of what the catheter looks like in cross-section in the vein. And this little area around the vein is what's called the saphenous sheath. It's this little potential space around the vein. Looks kind of like a cat eye. Well, what we'll do during the procedure, once we numb up your skin and do a small little micro needle to get in, we get a little tiny wire and then a slightly bigger wire, and then ultimately our catheter. And so we have that catheter in the vein. And then what we'll do is we'll inject, if we're using a heat-based ablation, like a laser or a radiofrequency catheter, what we'll end up doing is injecting what's called tumescence. It's very similar to the stuff that they use for liposuction, where it's a cold, dilute lidocaine saline solution. And what we'll do is under ultrasound guidance with a couple additional little needle pokes in the leg, we'll actually get our little needle into this little saphenous sheath around the vein. And what that's going to do is a couple of things. It's going to help insulate the vein from all the other tissues around it. So as we're heating that vein up to cauterize the inside and kind of spot weld it shut, we're not letting that heat transmit to the skin above it or the muscles below it. In that solution is a little bit of lidocaine, so it's completely numb. So you're not going to feel any of that when we're doing the actual vein ablation. And third, and most importantly, by filling that area with fluid, it's taking that big bulgy vein and squishing it down tight around the catheter. So you have good, we call apposition, meaning that the vein itself is squished onto the catheter. So as we're heating the catheter, it's heating up and cooking all of the bad vein. So what we'll do is we'll get the catheter in the appropriate position. We'll make sure that the catheter is at the highest safe part of the bad acting vein to shut down, but not extending into what we call the deep veins, because remember the superficial veins dive into the deep system. And so we're going to make sure that we're looking with ultrasound the entire time to make sure our catheter is in the right position and that we're in the correct vein. We then inject the tumescence, or that numbing solution, around the vein. That's pretty painless. And then we'll basically heat up the catheter, and if it's a laser, we kind of keep it hot the whole time and kind of pull it out slowly. Or if it's the radiofrequency catheter, we'll kind of spot weld it like 10 centimeters at a time from the top to the bottom. And we shut down that whole vein up in this area, and then it's gone. And then you can't have leg swelling from it anymore. If we're using a non-heat type approach, it's all the same steps of poking into the vein, getting a catheter into it, but instead of spot welding that vein shut with heat and getting it to shut down that way and injuring the inside of the vein, what we're doing instead is we're injecting a foam solution or a type of superglue type solution to get the vein to stick to itself and shut down. Either way, our goal is to make it so that vein's not open anymore, that there's no clot in it and there's no clot above it, and to make sure that that vein can't let blood flow the wrong way back down your leg, causing leg swelling in the future. In summary, vein ablations are when we shut down a bad acting vein, making sure that the remainder of the veins stay open and keep doing their job. You want this to be done by a board-certified vascular surgeon in a certified or accredited vein center. Sarasota Vascular Specialist only has vascular surgeons that are board-certified, and we have an accredited vein center. We're the first accredited vein center in our area. If you have any questions, please feel free to reach out, leave a comment below, visit us at sarasotavascular.com. Again, I'm Dr. Jason Wagner with Sarasota Vascular Specialist, and this is another Whiteboard Wednesday.
Thank you.